Hi, my name is Alan Henry, and I'm going to be discussing HIV among the LGBTQ A12 population. This presentation is going to address why HIV is a specific problem for the LGBTQ population, what the depth of this problem is, the impacts of this health problem, and finally an article discussing this health problem will be incorporated as well, along with advocating for individuals with HIV among this population. According to the Healthy People 2020, a health problem associated with this population is HIV. In Healthy People 2020, an objective HIV 24 is to reduce the percentage of young gay and bisexual males in grades 9 through 12 who engage in HIV risk behaviors. The baseline year for this group of people was the year 2015, in which the percentage of males partaking in HIV risk behaviors was 35.2%. The target was to reduce that number down to 30.7%, which is the National HIV and AIDS Strategy target. This health problem is specifically a problem concerning the LGBTQ population, and also discussed during the CDC in 2010, sexually transmitted infections, including human immunodeficiency virus, are major concerns in some of the LGBTQ groups, particularly men who have sex with men, and male to female transgender persons as well. Men who have sex with other men account for nearly half of all people living with HIV in the United States, despite making up approximately only 2% of the general population. In addition to this statistic, in 2009, this population accounted for 2/3 of all new cases of HIV. These numbers show that HIV is a lot more prevalent in the LGBTQ population, and it is in relation to their participation of risky behaviors. For example, the use of not using condoms is a big contributing factor as well to why sexually active men who have sex with other men are the majority number of people being diagnosed with new cases of HIV. The incidence of HIV has also increased 50% from 2006 to 2009 among young black men who have sex with other men in particular. These statistics show how HIV could be considered a health problem associated with the LGBTQ community just by the sheer growing size and percentage of cases each year due to their risk behaviors. The depths of this health problem will continue to increase until proper actions are taken by the members of this population to help reduce their risk of acquiring HIV. Along with the members of this population, with healthcare providers and nurses alike, being able to advocate for these patients to look at different resources and places that individuals can go and medications that they can use to help prevent the spread of HIV is also a big thing that can help reduce this number. This health problem is impacted by the concepts of vulnerability in regards to social stress, physical environment, and access to healthcare. Discussed in an article by Rubble in 2008, several studies have also suggested higher rates of depression, anxiety, and suicidal ideation among gay, lesbian, and bisexual individuals. This shows social stress among the LGBTQ community, and with the increase of substance abuse among this population, HIV becomes more prevalent due to the risk behavior of sharing needles when using drugs as well. A male who is sexually active with another male who may be infected with HIV will increase their risk of acquiring HIV if proper precautions are not taken. In regards to access to healthcare, some members of the LGBTQ population may be uncomfortable or embarrassed to talk to their healthcare providers about their sexual orientation in fear of being judged, and this in the long run will affect their overall health if they aren't seeking the proper care for what they actually need. Some recommendations here: increasing facilities for access to healthcare such as Evergreen. There are places around in the Buffalo area, for example, Evergreen, where they specialize in HIV prevention and the use of PrEP, where you can see with the fourth bullet down here, with education for preventative measures such as safe sex practice and being tested with your partner and making sure that you are also taking care of yourself in a way just in case your partner may not be 100% honest. Advocating for these patients to receive proper care every single time you interact with a patient, ensuring that they're going to normal doctors, addressing all concerns and being honest and being able to have that open, comfortable relationship with them will allow them to feel more comfortable to open with you and address these concerns that may otherwise bother them in the past. Having free clinics to those at risk of acquiring HIV, a big thing with increased cost of healthcare. It is difficult for them to be able to seek this treatment that they're actually requiring to take care of themselves. So possibly having these free clinics will then go ahead and open up more opportunity for them to be cared for properly and seek the medical treatment that they need. In an article titled Hypersexual Behavior and HIV Sex Risk Among Young Gay and Bisexual Men by Emily Yeagley, they talk about the topic of sexual behavior among gay and bisexual men in their relation to HIV. It discusses behaviors of the LGBTQ population that increase the risk of acquiring HIV. These include multiple sexual partners, not using protection, and the increased urge to have sexual relationships as young men. She discussed one thing that I think, as you can see at bullet point number 3, of acknowledging certain things is a huge thing that healthcare providers need to do, and that would go a long way for advocating for patients and for these individuals who know that it is okay and that some of these risk behaviors are going to be part of that everyday life for them. Our findings from this also suggest that hypersexual behavior may reflect the use of sex as an adaptive strategy in coping with life stressors. Consequently, though, while it is possible that risky sexual behavior, for example, like sexual multiple partners, may lead to heightened HIV vulnerability, we must also acknowledge the social and psychological value that sex plays in young gay and bisexual male lives, to be able to understand where they're coming from and why they may be doing these actions and not judge them in the process. So in conclusion, you can see that this is a growing health problem associated with risk behaviors among this population, but with proper precautions such as PrEP, educational points that healthcare providers can give them on where to seek help, how to go about preventing it, and using those like condoms and PrEP and everything like that can help decrease the risk of acquiring it. Gaining that access to healthcare, having those free clinics, giving them the information, pamphlets, anything like that about places like Evergreen can help them understand and realize that there are places out there that can help them. And being a huge advocate for our patients, they only have so much of a voice, and if they're not feeling comfortable and they don't feel like they can be expressive with their individuals, they're not going to be able to feel comfortable enough to receive that healthcare that they actually need. So going out of our way, suggesting things to other providers and other disciplinary areas for their care, they can receive that whole well-rounded care that they actually need to take care of themselves to have the best overall health long run in the future. Increasing problem can be addressed and taken care of with proper precautions, which will help maintain that health status of members of this population for the future. And here finally, you're going to see a list of references used throughout this PowerPoint. Thank you very much.